some rare good news today regarding the coronavirus. The most recent data from Pfizer shows their vaccine is working.
Here to talk about that data is Dr. William Hartman from the UW Health. He's also running the AstraZeneca trial here in Madison. Doctor, good to see you again.
Thank you.
What did you take away from the news from Pfizer today?
Well, I think it's a giant step forward. You know, they showed that there was a 90% reduction in the number of cases compared to their placebo group. This is far greater than what was expected and what they had even hoped for. So this is a step towards getting us back to living a normal life.
Doctor, what happens next after this? I know the trials are far from over.
Well, all of the trials are going to continue as they have been set up to do. It's going to take more than one vaccine candidate to get us out of this pandemic. And so we have to find out which vaccines work for which people and when is the best time to give them and how long does that immunity last. So there's a lot of science that we still need to accumulate and to understand before we're fully out of this. Like I said, this is just a big step forward.
So in the end, will there be more than one vaccine on the market?
I do believe that there will be more than one vaccine. We're in the process of trying to figure out which vaccines are the right vaccines in younger people and older people. How many times do they have to be given within a year or over a couple of years? And so to get all of these candidates studied and in line for the right people that they're intended for, we have a lot of work to do.
As a physician who is on the front line and running the AstraZeneca trial here at UW, how did this make you feel hearing about that there is promise out there?
Well, as a person who's working with these vaccines and reading about them and studying them very closely, I am a big believer in the science behind them. But I know that there's a lot of people who've been skeptical about it. So I hope as they look at the data, as the public looks at the data, as they see who is evaluating the data and the process that it takes to go from step A to step Z, they see that the process works and that when a vaccine is available, it's going to be effective and it's going to be safe.
What's the status of the trial going on at UW-Madison with AstraZeneca?
So we're in the active enrollment phase right now. We're still taking in participants. Today we had a full slate of participants coming in to be screened and receive either the vaccine or the placebo. We've got this continuing until nationwide we hit this 40,000 participant number. We'll be continuing to enroll until we get there.
So it's going to be a while even for the Pfizer vaccine.
It's going to be a while. They have to go back now and study the safety data behind the vaccine, make sure that everything holds true, that it's a safe vaccine to move forward with. But then they have to go through the process of being approved for an EUA by the FDA. That takes some time. It takes a lot of input. So I'm still thinking towards the end of this year is when one of these vaccines will be available. But then the distribution phase takes over, and we'll have to see how that all plays out.
As we said, there's some rare hope in all of this.
Yeah, absolutely.
For now, keep wearing the mask and social distance. Doctor,
Great.
Thanks for being with us today.
Thank you.
Thank you.